Are you one of the millions of Americans that suffer from back and neck pain? Have you been through treatments such as traditional chiropractic care, physical therapy, epidural injections, or even back surgery with little or no success? These treatments do not address fibrous adhesions. In order to offer long-term pain relief, the fibrous adhesions in the joint capsules, discs, and surrounding supportive tissues must be treated. There is a solution: manipulation under anesthesia, known as MUA. MUA is a safe and proven treatment for chronic neck and back pain. At the Beltier Surgery Center, located across from the Boca Raton Community Hospital, our highly trained staff of professionals is experienced with MUA. They have helped many people regain a pain-free way of life with MUA treatment. The MUA procedure uses twilight sedation to relax restricted muscles, allowing the physicians to gently stretch and adjust the spine. The MUA physician is trained to recognize where and how much stretching and adjustments are needed for each patient.
A typical patient would be a patient that has chronic pain that does not respond well to traditional chiropractic care, physical therapy, epidural injections, and the typical patient that we see has chronic neck pain, chronic back pain, chronic tightened and contracted muscle tissues.
We give them a short-acting sedative, which for approximately 10 to 15 minutes of the procedure allows them to completely relax. We can get a range of motion that we could never hope to get otherwise, always under caution and always, with physiologic motion and ranges in mind. And then afterwards, we follow that up with a focused course of physical therapy to cement those gains. Lower back pain is the second most common cause of patients coming to the doctor.
My back pain started years ago, and I had been seeing chiropractors through the years. I've done a number of things, but it really came to a head last year, and it was becoming a really chronic, constant pain. And I really felt like I needed an alternative, and this was the one for me.
When the muscles are relaxed, we are able to get in there, stretch them out, and alter some of these scar tissues that have formed over the years and allow the muscle to re-heal itself in a nice aligned fashion.
When I was pregnant with my first son, I was rear-ended and from the back, and I had the railroad tracks came down on my car. So, you know what, I've had neck pain ever since then, really. They said I had soft tissue damage. I would always be in pain. Dr. Fisher would adjust my neck and it would go away, I'd feel better, but then it always came back. Then it started getting to where it was only lasting a couple days, then one day. So that's why we made the decision to do the MUA.
What have you been suffering from?
Lower back pain. Played football for 12 years, and I got some lower back pain from tackling too many people. Been to different chiropractors, acupuncturists, hypnotists. I went to discuss spinal decompression, but the problem with spinal decompression is that you're not really relaxed enough to actually get into the muscles in the spinal cord. So we discussed doing MUA, which would allow you under anesthesia to be relaxed enough to get into the muscle and the skeletal fibers.
After the procedure, patients wake up within 15 to 20 minutes with really no residual side effects or sedation. We've been very, very encouraged by how well patients tolerate both the procedure as well as the sedative medications. It's truly a safe procedure that we are very comfortable performing.
The anesthesia is nothing to worry about. There's no, since you're not having surgery, there's nothing to recover from. They're not, you're not having as much as you would with a surgery, so you just kind of come right out of it. I went right to work and carried on my day.
After the procedure, I felt great. It was a great relief. It stretched out my back and my shoulders and my leg muscles. I had some very stiff calf and hamstring muscles because of the lower compression on my back, so it stretched that out as well and really got into making me feel more relaxed. There's less tension in those places.
My apprehension was more about the anesthesia than anything else, just because it was 3 days in a row, and it was, I mean, it was a breeze. I had no problems at all, and I feel very comfortable now saying that I feel it's a safe procedure.
I tell everyone about this procedure. I feel so great. I mean, when you're in pain, there's not a whole lot you can do. So your life stops in a lot of ways when you're being active. So I'm much more active now and just happy and comfortable.
Before I knew it, I was back up, and it really went pretty quickly. So I felt relief like right away. It felt better.
I would recommend it highly. It's a very good procedure, and it may seem that it won't work, but it will work.
Only a physician that has been certified in MUA can perform this procedure. The results of the MUA include altering pain-producing scar tissue formations, decompression of bulging herniated discs, stretching of chronically tight muscles, and eliminating pain by improving range of motion of the affected joints. To find out if MUA is right for you, call 561-347-6682 to schedule a consultation. Here are some of the common conditions successfully treated with MUA.